Hello, everyone. Welcome on. While everyone is joining us tonight, I'll go ahead and get started. So, good evening. My name is Christina Wigren, and I am with Stilly Valley Health Connections. Thank you all so much for joining us for tonight's Narcan training. For everyone who's joining us live today, please note that this class is set up in a Zoom webinar format. This means that all participants are muted and your videos are turned off so that we can record this presentation. However, if you would like to leave any questions or comments, we encourage you to do so by using the chat or the Q&A box at the bottom of your screen. Now I will pass it over to Amy Wheat, who is an opioid outreach specialist with Snohomish County Human Services. She will be presenting on tonight's topic. Thank you so much for being here, Amy, and thank you to everyone who's joined us so far. We hope that you find this program very educational.
Thanks, Christina. Hello, everyone. Thank you for being here tonight. Again, my name is Amy Wheat. I'm the opioid outreach specialist with Snohomish County Human Services. It's unfortunate. There's so many benefits to having this recorded, and I prefer in-person trainings just because of the conversations that can happen. So I want to encourage you, if you have questions or comments, please feel free to put them in the Q&A or the chat box. I'll get to them as I can, and Christina will also help facilitate those questions. Tonight, we're going to learn about what is Narcan or naloxone. We'll talk about what opioids are and how they work. We'll discuss the overdose problem. You will learn how to recognize and respond to an opioid overdose. And we're also going to talk about fentanyl. We'll go over the Good Samaritan naloxone law for Washington State, and then how you can get Narcan. So the best part is that anyone who attends this course is eligible to pick up a free Narcan kit at Stilly Valley Health Connections. So we can talk more about that at the end, and figure out a way that is going to work best for everybody to get their Narcan. So let's start out with what is Narcan or naloxone. Narcan is the brand name for the naloxone medication. They're the same medication, so you hear them used interchangeably often, but they are the same medication. The only thing that this medication does is work to block or reverse the effects of an opioid overdose. So anyone can use this medication easily to save the life of someone who is possibly overdosing on opiates or opioids. Back in March of 2023, the FDA approved this medication to be sold over the counter, which sounds great. That used to be behind the counter at the pharmacy, making it a little bit more difficult to obtain. However, prior to becoming an over-the-counter medication, if you walked into the pharmacy and wanted to purchase Narcan, you could, and if you wanted to pay cash for this kit, it would cost between $120 and $165 cash. So it's an expensive medication. Excuse me. So it was a little bit concerning, wondering what this was going to look like when it became an over-the-counter medication, simply because the price point was so high. Now we know that the medication is over the counter. It's in most pharmacies. It's also sold on Amazon, and it's typically about $45 to $50 cash if you wanted to go and purchase it. So why does Snohomish County have an opioid outreach specialist? Can anyone guess? Have you turned on the news lately, or have you driven around major cities in our area? Back in 2015, Snohomish County Human Services partnered with law enforcement in Snohomish County to provide every officer or deputy with a Narcan kit. Typically, law enforcement is first on the scene when someone calls 911. So it was important for them to have this medication. Excuse me. Need to get a sip of something here. To have this medication to be able to save someone's life. So in 2020, December of 2020, this program moved over to the health department. This one-year pilot project was supposed to go for the 1 year, but it ended up going for 5 years because it was so successful. Law enforcement saved over 300 lives by being first on the scene and saving lives. So the idea came about, well, when someone experiences an opioid overdose, what happens? Typically, they go back to the area that they had experience the overdose. So what happens? The same patterns happen. So the idea was to have a liaison to work with individuals who struggle with opioid use disorder or had experienced an overdose. So I'm lucky enough to work with individuals who struggle with opioid use disorder and help provide support and resources and get them going in a different direction when they're ready to make that change. I work with the Scout team, which was formerly the Office of Neighborhoods. So our team partners with Snohomish County Sheriff's Office, different law enforcement agencies throughout the county, to work with individuals who are struggling, um, not only with substance use disorder, but mental health issues, as well as experiencing homelessness. So I do have a caseload, but the second part of my job is being able to provide education to multiple places, not only just the communities, but law enforcement, the school districts, public nonprofits, helping educate people what is really going on with this epidemic. Because what I've learned in this position is that lack of education produces a stigma, and there is a huge stigma surrounding opioid use disorder. So starting at the baseline, what are opioids? Opioids are a class of substances. They're analgesics, so they block pain, but they have a depressant as well as a euphoric effect. Sometimes you hear the word opiate, and then you also hear opioid. So what's the difference? They do the same thing in our brains. The only difference is that an opiate comes directly from the poppy plant. So when we're talking about opiates, we're talking about codeine, morphine, heroin, and opium. When we're talking about opioids, those are drugs that are a full synthetic or a partial synthetic drug that's manufactured in a lab. And they work in a similar way to as an opiate. So those would be any medications that you are prescribed from your doctor, Percocet, hydrocodone, OxyContin, anything that can be produced in a lab. So we went through 3 phases. We're going into the 4th phase of this opioid epidemic in our country, where it started out originally with the prescription medication, right? So that was the main issue back when OxyContin came out, and it was considered non-addictive, which they then found out is highly addictive. So it moved from this prescription pill epidemic into heroin, and then to fentanyl, and now we're in the polysubstance epidemic, which is multiple drug use, specifically fentanyl or opioids and methamphetamine. So when we're talking about drugs that are not opiates or opioids, those are going to be what we know as methamphetamine, cocaine, ecstasy, a benzodiazepine, which would be Valium or Xanax, marijuana. Those drugs are not opiates or opioids. And the reason it's important to know that is that if you come across someone who's experiencing an overdose and you give them Narcan, but they're, say, overdosing on a Xanax, the Narcan will not help them. It won't work to reverse that opioid overdose. The only thing that this medication does is work to knock the opioids off of the receptors and give the person a chance to breathe. Now, if you're unsure, because this is such a safe medication, I would still administer the medication of Narcan to see if, potentially there are opioids in whatever the substance is that they were using. So how do people use opioids? Both prescription and non-prescription opioids can be orally ingested, they can be smoked, snorted, or injected. When we're talking about prescription opioids, we know that when we take prescription opioids as they're prescribed by our doctors, the effects will be predictable. Based on your height, weight, any medical conditions that you have personally, and any medications that you're taking, that's all information that your provider takes into account. And based on that information, they can predict how you will respond to an opioid. It's when we take a prescription that was not intended for us that the effects become unpredictable. So, for example, if you go to a friend's house and you're complaining of a horrible headache, and your friend says, "Well, I have Vicodin prescribed by my doctor for my headaches, you're welcome to have one." Well, your friend is not trying to harm you in any way, but the problem is that they have no idea how your body will respond to that opioid, and therefore it puts you at risk for an overdose. Excuse me. When we're talking about drugs that are non-prescription opioids, um, The effects will always be variable. And that's because the street drugs right now, you just don't know what you're getting. The DEA says that drugs change hands at least 10 times before they get to the person that is actually using them. So you don't know what's happening through all of those exchanges. So the effects will always be variable, therefore putting you at risk. So who uses opioids? Yes, a person with a substance use disorder, we know that, but also someone that's just had surgery or someone that is experiencing chronic pain or medical issues or dental pain. All valid reasons to be given a prescription for an opioid. Who can overdose? All of the above. Honestly, even though your doctor can predict how your body will respond to an opioid, it can still be a dangerous medication. So it's important to know what you're taking and follow the directions. So again, family members or friends that use a prescription that is not intended for them. Also, kids that think that medication looks like candy. I'm going to show you in a few slides some pictures from our drug task force of some pills that were taken. They're fentanyl pills, but they look like the Lucky Charms marshmallows. Now, from my experience, the cartels are not focusing on the toddlers and trying to sell these medications to the toddlers. However, they do have a brand. And that brand is focused on money. So they want individuals to come back and purchase their product. So if the problem is that if you have these pills that look like candy or you drop them somewhere, maybe in a playground or a park, the problem is if a child, what do they do when they find things? They put them in their mouths, right? So there's a high potential that there could be an overdose if a child finds one of these pills and does put it in their mouth. Another example is if a person forgets if they've taken their medication or not. So as we age, I can account for the fact that I forget things quite often. Usually by noon, I don't remember if I took my vitamin that morning. So imagine as we age and we're taking more and more medications and we're responsible for being in charge of when we take them and what we're taking. It's possible to forget if you've taken a prescription medication and therefore puts us at risk for an overdose. If a person is experiencing more pain, so they take extra, for example, say you just had a knee surgery and it's like, I have 1 hour until my next pain pill. I think I'll take my pain pill an hour early and then try to stretch out on the other side and push out taking my next pill at a later time. When we start manipulating those time frames, that puts us at risk for an overdose. If a person hasn't used an opioid for a few days or more and resume use, this is a high potential for overdose because opioids are tolerance forming. So this is probably the most individuals that I work with. So I spend a lot of time in Snohomish County Jail while working in the jail. I work in the jail. So if I'm working with an individual and they get released before we have a plan set up, and they go back to using the same amount of opioids as they did the day that they got arrested, there's a chance, high potential, that they will experience an overdose because even after a few days, their tolerance has gone down. This can also be the case, though, if someone maybe goes to a detox and they're waiting to go to treatment, but their bed isn't available yet for their treatment date. So they have a few days in between. If they use during that time frame, again, their tolerance has gone down. So that puts them at risk for an overdose. And then finally, a person who combines an opioid with another drug, especially alcohol or a benzodiazepine, which is Xanax or a Valium, those are also respiratory depressants and therefore puts them at a higher risk. I'm just going to look and see if there are any questions really quickly. Offer a certificate. Yes, I can definitely provide a letter that states that this training has been completed. So I'll just get that information via email from you at the end. And we can talk about that. All right. Okay, so one thing that's important to understand is that you can be physically dependent on opioids and not have an opioid use disorder. So let's go through the steps of that. When we're talking about tolerance, this is, everybody's pretty much familiar with tolerance, but let's just talk about this to start. When a person is using a substance and as time continues, they need to use more and more of that substance in order to get the same effect as they did when they started. So, for example, my daughter, 20-year-old, goes to Arizona State University. I'm sure when she turns 21, it'll be the first time she drinks a beer. So she's going to have a beer and she's going to experience an effect from that. As time goes on, she would need to drink another beer and another beer to achieve that same feeling. That's the same thing with opioids. What happens is the more you continue to use that substance, your body starts to become dependent on that. And when you stop using whatever that substance is, you experience a physical withdrawal. So if we all left here right now and we went to let's say we went to Providence Hospital, and every single one of us in this room were given a prescription for oxycodone to take as prescribed for the next 2 weeks, and we met back here in 2 weeks, every single one of us would be physically dependent on that opioid. Now, that does not mean that we are all struggling with opioid use disorder. What it means is the next day, when you don't take that medication, you're going to have a physical response to that, and it's going to be uncomfortable. So, for example, if you are taking a prescribed blood pressure medication and you just stop taking it, your body will experience a physical withdrawal and feeling from stopping that medication. The difference is when you cross over to addiction, the compulsive drug use continues even though there's harmful things happening all around in life. For example, work is affected, there's legal issues, social obligations, family, friends, relationships are all affected negatively, and yet the continued use is going on. So that's the difference between being physically dependent and then opioid use disorder. So this is how opioids affect our breathing. We all have opioid receptors in our brains. And for today, we're going to pretend that they look like these corkscrews. So as we use an opioid, reflected by the red dot, they sit on the receptors in our brain. What happens is when all of these receptors are full, you stop breathing. So that's what's happening when someone experiences an opioid overdose. The overdose problem we know has increased drastically over the last 5 years in Snohomish County, with fentanyl being the most common substance involved in the fatal overdoses. In 2023, 256 deaths were related to fentanyl overdoses. There were 270 total deaths that were related to any opioid. Between Providence and Swedish Hospital in the year 2023, there were 1,031 individuals that went to the emergency room and were experiencing an opioid-related event. And to be honest, that number is actually very underreported because if we administer Narcan to someone, they are not required to seek medical attention at a hospital after that experience. So a lot of times people don't want to go to the hospital, and this number is still astronomical. So there is reports that the overdoses nationally are decreasing, which is great. We will talk about that in just a second. I do want to bring up one point. If you're interested in the data of what's going on around Snohomish County specifically, this website, SnohomishOverdosePrevention.com, is a plethora of information. It breaks down demographics by zip codes, the ways people are using and what the overdoses are. It's a great source of information. There's one question that I do want to ask though. If you had to guess, what percentage would you think in 2022, how many people that experienced an opioid overdose were also experiencing homelessness? So in 2022, how many people were that experienced an overdose were also experiencing homelessness? Now, for me, my caseload, I said 100% because that's who I work with. But the actual answer is that in 2022, 57% of opioid overdoses occurred in a private residence. That is not what we're seeing when we turn on the news and what we are hearing about the opioid epidemic. It's always like this is what's happening on the streets and this is who's struggling with opioid use disorder, when in fact, Opioids can be extremely dangerous, and there are a lot of overdoses that occur that are accidental, medication mismanagement. There's a lot of different things going on with this, so it's really important for us to understand what's really going on. So this is one of my favorite graphs. They don't make it anymore. So I do keep it on here just for reference because I want to show you in 2022, there were almost 108,000 deaths in our nation. And this is all drug use. Okay, so this is a large number. When we're looking just at opioids, they have through 2021 and it was over 80,000. Now, as I said, the provisional data that's coming out from the CDC right now is showing that we've had the first annual decrease in overdose deaths since 2018. So that's amazing. Almost a 3% decrease. Here's the thing though, when we're looking at 2022, all drug use was 111,000. 2023, over 107,000. And with opioids, 2022 was 84,000. 2023, we're back to 81,000, which is what we were in 2021. So yes, there's a decrease, and this is great. There's a lot of different reasons why people are speculating the death toll is going down and decreasing. One of those being that we have more access to Narcan. I've been in this job long enough to know that I can't force someone to do something different. If they don't want to stop using opioids, they're not going to. However, if they have an overdose and we don't administer Narcan, there's a no way for them to make that choice that they want to do something different, right? So that's the purpose. The main focus of us having access to Narcan is giving someone a second chance and helping them get to that point so that when they are ready to do something different, they have that opportunity. Before we go through the steps of administering Narcan, I want to talk about how to prevent overdose. It's really important to keep medications high, out of reach from children. We know that the medication pill bottles are not childproof. I did a training once, and a gentleman raised his hand and said that, well, I have my grandkids open all my pill bottles for me because I can't get them open. So relatable. I understand that. But the problem is that we need to keep our medications locked up, stored away, and out of the reach of individuals that come in and out of our homes. It may not be our children, but our children have friends and people come in and out of our homes. So I do have these medication lock bags, and kind of hard to see on the screen. There is a key inside, but you can manage your medications and keep them in here. I am going to bring some of these to Stilly Valley as well as the Narcan. So if you decide that you want to pick up a Narcan kit and would like a medication lock bag, please take one. I had a client share with me that he had stolen his stepdad's heart medication to take to a party because he was unsure if that would work to get he and his friends high. So it doesn't have to be just opioids, but really any medications. Another situation was a woman shared with me over the holidays. She'd had a large family dinner with extended family, some family members that she didn't know very well. She had run upstairs to get something and found her second cousin rummaging through the medicine cabinet in the bathroom upstairs. So again, it's just keeping people safe and protected and our medications locked up. The second piece to this is getting rid of expired, old, and unused medications. Again, the home medicine cabinets, they can be the new drug dealer for children, and they put them at risk. We don't want to just flush them or throw them away. Most pharmacies and most police departments have the medication lockbox or the lock drop boxes that you can go and dispose of any of these medications on this list. No questions asked. So let's talk about Narcan. The kits that you will be getting, each kit contains 2 doses and they expire after about 2 to 3 years. If anyone here currently carries Narcan and you get another kit, I would suggest keeping the old Narcan that you also have. Reason being is, yes, it expires after 2 to 3 years, but it's better to have an expired Narcan than to not have any at all. The most that I've heard with fentanyl on the scene is using seven doses of Narcan. So if you have some that's expired, you can utilize those as well. It is best kept at room temperature. This right now, if if you're keeping this in your car with the cold temperatures and the freezing, this medication does freeze. So, and it takes about 15 minutes to thaw. So if you were to come across someone and needed to administer this medication and it was frozen, it would not be helpful. So, if you are going to keep it in your car, when it's extreme temperatures of either cold or hot, it's best to take it into the house and keep it at room temperature, just for best practice and to help it not lose its efficacy. We do know the local use of naloxone is increasing. So in 2023, 76% of those 1,031 patients that went into the ER had already been treated with Narcan. This is great news. At least 17% of the time during 2023, it had been administered by a community member, a friend, family member, or a bystander. The best part is that the first 2 quarters of 2024 show that that number jumped to 28%. So that means more people, again, have access to Narcan. This is a life-saving medication, and it's very easy to use. So you will learn how to recognize an opioid overdose and respond. Our job is to help get the person breathing. We want to respond in a way that they seek medical attention, and then the professionals can take over and assist from there. Sometimes it can be hard to tell if someone is experiencing an overdose or they're just really high. If someone's overdosing, their skin will be pale and clammy. Their fingertips and lips will start to turn a bluish or an ashy color. Their heartbeat will be very slow, their pulse will be slow, and they're probably not breathing. If they are breathing, it's going to be very infrequent, and they're probably making a deep snoring noise or a gurgling sound. People refer to that as the death rattle. The biggest tell is that the person is not responsive to any type of stimuli. So if you're shaking them and they're not responding, you're using a loud voice, they're not responding, the next best thing you can do is administer the sternal rub, which for those who don't know, you take your middle finger and put your knuckle up, middle knuckle, and then you rub on the sternum. It's extremely uncomfortable. And believe me, if you think someone is overdosing, your adrenaline is going and it is not going to be done softly. So if they don't respond to that, you're going to want to get your Narcan. So how does Narcan work? The only thing that this medication does is knock the opioids off of those receptors and blocks them, so it gives the person a chance to breathe. This medication starts working within 1 to 3 minutes and it lasts for about 30 to 90 minutes. Now, this medication cannot be abused, it can't cause an overdose, and people are not allergic to it. When you administer Narcan to someone who is physically dependent on opioids, it will cause them to experience severe withdrawal symptoms, such as nausea, vomiting, muscle discomfort, diarrhea, chills, very disoriented. So someone who's dependent on opioids may tell you that they're allergic to Narcan, but they're not. They're just experiencing the side effects of withdrawal symptoms. Now, if you were to come across a child who had ingested one of those pills and they were experiencing an overdose and you administered Narcan to them, they're not going to experience any of these side effects because they're not physically dependent. This is an accidental overdose. When we administer Narcan, we want to be prepared for vomiting, potentially some combativeness. Here's the thing, when someone experiences an opioid overdose, they have no idea they overdosed. The last thing that they know is that they were using a substance. Now they're waking up to probably police, paramedics, strangers, on top of feeling terrible, like the worst flu they've ever experienced. So they may be a little irritable, a little short-tempered, but it's shown that people administered Narcan through the nasal spray is a little bit less coming across as combative once they've received this medication. So the steps you want to take if you come across someone And you see them, say you're going to the store and you are in the parking lot and you see someone that you know something's wrong. The first thing you want to do is ask them if they're okay. They don't respond. You know something's wrong. So before you do anything, you call 911. We call 911 first because, again, our job is to help get this person breathing with this medication. We're not the paramedics to take over and take care of the medical needs. So we call 911. We let them know our location, that we have Narcan. Sometimes the dispatcher will stay on the phone if you, especially if you'd like them to, you can put them on speakerphone. But the process then is after we call 911, we want the person to be on their back. So we turn them so they're laying flat on their back and you do the sternal rub. If they don't respond to the sternal rub, you're going to want to get your first dose of Narcan. So you get 2 of these in one box. You don't have to keep it in the box, but I would suggest keeping it in the blister pack. This medication is a one and done. So if you do bump it or test it, you will lose the medication. So keep it in the blister pack. So we've peeled the medication out of the blister pack. The person is on their back. You administer the first dose into one of their nostrils all the way until it hits the top of your fingers and then press. It's going to be hard to see on the screen, but you can see this shoots very high. So this person is not breathing, so they can't sniff in the benefits like Afrin or Flonase. It'll start being absorbed through the nasal epitheliums. So we've administered our first dose. They're on their back, sternal rub, no response, into the nostril, all the way till the tops of the fingers, plunge, and then this is garbage. At this point, you have 2 options. If you are CPR trained, you can start chest compressions after you administer the first dose. If not, the first step is to roll them into the recovery position because this person will probably start vomiting. So we want them to be on their side so that they don't aspirate. So we've administered the first dose, roll them into the recovery position, and then you wait for what feels like an eternity of 3 minutes. If the person has not woken up after 3 minutes, we want to put them onto their back again and administer the second dose of Narcan into the opposite nostril. Again, put them back into the recovery position. Now, because it's been at least 6 minutes since we've called 911, EMS, paramedics should be arriving, right? Your job is just to monitor the person until they the paramedics arrive. Let's see. I do want to mention if you have more than one kit, you can continue every 3 minutes doses until the person wakes up or until EMS arrives. Like I said, the most I've heard is 7 of these being administered for an individual that was experiencing an overdose with fentanyl. We don't all have access to 7 of these, which is another reason why we call 911 first. Oh my goodness, can't get my slide to go. Okay, so this is what happens when we administer Narcan. Remember, the opioids are the red dots in the brain. The medication goes in and it knocks those opioids off of the receptors, and then it sits on the receptors. So it blocks them. When this happens, that gives the person a chance to breathe. What you can see, though, is that the opioids are still in the person's brain. So remember how I said this medication lasts between 30 and 90 minutes? Depending on what the person used, how much they've used, and what their tolerance is, there is a potential that once this medication starts to wear off, those opioids can reattach to those receptors, and then the person can experience another overdose without actually using a substance. So that's another reason why we want people to go to the hospital after they've been given Narcan, because this is a real possibility. All right, we're going to talk about fentanyl. Fentanyl is a powerful synthetic opioid. It's similar to morphine, but it's 50 to 100 times more potent, 50 times more potent than heroin. I do have this. See, this is one benefit about being in person is I have these little vials that show you, I don't know if you can see, this would be a lethal dose of heroin versus a lethal dose of fentanyl. Don't worry, it is sugar, so it's not real drugs. But it is a good visual to show that it doesn't take much for someone to overdose if fentanyl is present. All right, one thing I want to do now is this is also a little difficult online, so I just want you to think about the answers. We're going to play true or false. There's a lot of misinformation, especially in the media, about fentanyl, so I want to discuss that. So if we were in person, I would have these cards for you, but I guess I'll just be playing by myself. So let's get started. The first one, true or false? Fentanyl is often described as 80 to 100 times stronger than morphine and about 50 times stronger than heroin. True. Oh, good job. You guys can do yes, you can. Thank you. Good job. Good group. That is true. But I start with an easy one. All right, second one. Fentanyl overdoses cannot be reversed. False. Fentanyl overdoses can be reversed. Fentanyl is an opioid. It's just a very strong, potent one. So it may take more than the two Narcan doses to help the person start breathing again. But in fact, yes, fentanyl overdoses can be reversed. Fentanyl is an illegal drug. This is a trick question. It's both. It's true and false. So fentanyl was created for the medical community. It is in a liquid form that is administered through an IV in a hospital setting through a provider. Or it's prescribed as a transdermal patch, a lollipop, or tea for individuals going through cancer treatment that need a powerful opioid for pain. That fentanyl is legal. What is illegal are the fake pills and the powder that is being sold on our streets. That is illegal. So the answer is both true and false. Fentanyl is moving through our street market and it comes in a powder form that can be injected, smoked, or snorted. It's also been found in other drugs like heroin, meth, cocaine, pressed pills, Adderall, Xanax, everything. What do you guys think? True. It is safe to assume that any street drug has been laced with fentanyl. Unfortunately, this is the case. Individuals who think that they are just strictly using methamphetamine or testing positive for fentanyl, people who think that they're purchasing cocaine for maybe a party weekend, people have lost their lives because it is laced with fentanyl. So it is safe to assume that it is in every substance. And finally, you can overdose just by touching fentanyl. That is false. There are reports that is true and that is inaccurate. If there was a pile of fentanyl powder sitting right here and I rubbed my hands in it, I would not overdose. Now, if I then touched my mouth, nose, eyes, there is a potential, yes. But just touching fentanyl does not cause an overdose. Even the transdermal patches that are prescribed through medical providers, they take 2 to 8 hours to start working and absorb through the skin. So it doesn't just immediately absorb through our skin. Now, I do have a fentanyl safety briefing through was produced by our health department. I can send that over to Christina. That can be emailed out to everyone that gives all the data and information about this. I don't want to downplay the fact fentanyl is extremely dangerous and very toxic. There's just situations that are inaccurate, such as my 16-year-old nephew who told me, I'm not going to help my mom grocery shop anymore because I saw on the news that there's fentanyl in the grocery carts. So that's not the case. I told him he needs to help his mom grocery shop and then he can wash his hands. But there is not just fentanyl everywhere that will cause you to overdose. Again, lethal dose of fentanyl, the tip of a pencil, similar to this that I showed you. It's very hard to see, but that's because there's hardly any there. For someone who does not use opioids, it does not take much for an opioid overdose with fentanyl. I took this picture a few weeks ago. I was with one of our deputies on our team. He had just arrested a person and had taken this off of the person. And it's a large block of fentanyl. The individual said that it was just for his personal use, which that is a large amount of fentanyl. But the point is this is what it looks like on the street, and this is how it's being sold. The other way is through these pills. So the fentanyl epidemic really started with these pills that were being manufactured to look like 30 milligram Percocet pills. Um, they are very deadly, and there's no way to know how much fentanyl is in each of these pills. So, for example, let's compare these to chocolate chip cookies. If you have a great chocolate chip cookie, you have a lot of chocolate chips in there, right? Terrible chocolate chip cookie, just a couple. Similar to these pills are made with no oversight, no way to know how much fentanyl is going into each of them because they're being made illegally. You could get one pill that has 20 micrograms of fentanyl and one that has 2. So you don't know what you're getting and therefore become extremely dangerous when they're being used. I had an individual that I worked with. He was not a drug user. He was a student at Central Washington University, and he had come over to this side of the mountains for a friend's birthday party. He was an 18-year-old kid. He had gone to the casino with his friends, and one of his friends had bought one of these pills and said, "Hey, do you want to split this pill?" Sure, what can a pill do, right? These don't look dangerous. They don't look deadly. Unfortunately, the individual I worked with, his half of the pill caused him to overdose. The other kid did not overdose. The half of the pill that the person I worked with had more fentanyl on that side, and that's because they're not managed or made in a way that there's any uniform process. Luckily, the casino did have Narcan. He did survive, but it was a really traumatic experience. These pills are called Skittles. This was from our drug task force here in Snohomish County. These were confiscated. They look very similar to the pills that I just showed you. Excuse me. But they're different colors. This kind of goes back to branding. This drug crisis is fueled by money. So dealers want people coming back to them. They want the best product. This is an example of one of those. The other one is these Lucky Charms fentanyl pills. So they literally look like the marshmallows from Lucky Charms. Again, these pills are dangerous, and if a child picks one of these up at a playground or a park and ingests it, it could be lethal. So let's talk about fentanyl exposure safety. So again, there have been no clinically confirmed overdoses from touching fentanyl or from breathing in secondhand smoke. Now, when someone is smoking fentanyl, the concentration of that drug is absorbed by the individual who's smoking it. So the secondhand smoke has very low levels of fentanyl. It is possible to feel or have a response to it in a negative way. For example, maybe a headache or nausea. Just feeling a little bit off, but there's not been any clinically confirmed overdoses from the secondhand smoke. Okay. The second piece to this is that when we're looking for protection, if you are in an area that you may come across some pills or something, some powder, you can wear gloves. And if you do touch it, it's important to wash your hands right away because it can be absorbed through mucosal membranes, which are mouth, nose, eyes. You don't want to use hand sanitizer if you come into contact with fentanyl. Excuse me, fentanyl. And that's because alcohol and bleach can actually cause it to absorb more quickly into the skin. So you want to wash your hands with water and soap. If you're going to be in an area where someone is using substances, an N95 or an N100 mask can also help with protection. So the Good Samaritan naloxone law for Washington State says that if you administer Narcan to someone you come across and you give them this medication, there are no civil or criminal liabilities that can come against you. So if someone is upset because you've given them this medication and they feel terrible because they're opioid dependent and they say they're going to sue you, they're not going to sue you. There's nothing that can come against you for administering this medication. The second piece to this law is for individuals who are using substances together. And this was important because people were losing their lives just at a high rate because people were afraid to call 911. If people are using substances together and someone overdoses, the other person wouldn't call 911 because they were afraid they were going to get arrested and go to jail. You can call 911 and you will not receive any charges for your drug paraphernalia or your drugs. Your drugs and paraphernalia will be taken by law enforcement, but you're not going to go to jail specifically for new charges of drug violations. So finally, again, you don't need a prescription to obtain this medication. However, if you are given a prescription for an opioid, it is likely that your provider will also write a prescription for Narcan. Again, because opioids can be dangerous, they can cause overdoses. Having this medication is important to have close by. Narcan may be covered under under insurances if it's written as a prescription, and it is still covered under Medicaid. So the individuals I work with, I encourage them to go to the pharmacy and get a Narcan kit. If they're experiencing an overdose, they can't administer Narcan to themselves. However, if they have it in a backpack or somewhere close to them, someone else could potentially at least administer the medication. So again, it's between $45 and $50 per kit if you want to go on Amazon and purchase it or go to the pharmacy. There is a resource that I have listed here. It's the phra.org. It's People's Harm Reduction Alliance, and they are an agency out of King County that will ship a free Narcan kit to anywhere in Washington State. So if you have family members or friends that live in a different part of the state that would benefit from carrying Narcan, this is a great resource. You just go onto their website, name and address, and then differentiate if you would like the nasal spray or the injectable, which you've been trained on the nasal spray tonight, and then they will ship it directly to that address. And now it's time for questions. Possible to get an email or certificate? Yes. I will send a letter that says that that this course was offered on this date, and then we can put the names in there, and I can work with Christina on that and get it emailed to you. Lori, where can we receive the Narcan from this event? So Stilly Valley Health Connections is located in the Smoky Point area. I can let Christina talk about that. But essentially, if you want to go and pick it up there, then you can stop by. And also, like I said, please, medication lock bag. Clinton, I see your email address. So I will send that to you. Where would you inject the Narcan? Typically in the thigh. Tina's question, where would you inject the Narcan? It would be in the thigh, and it's intramuscular, so it's very easy to do. A lot of times individuals that are carrying Narcan may want to they may not feel comfortable with needles, and so that's why the nasal spray is what we train on.
Thank you so much, Amy. Just to chime in on a couple of the questions here. The Narcan will be available at the Stilly Valley Health Connections facility. I just put the name of our facility as well as the address into the chat box for everyone. We actually have some Narcan available from Amy right now. So if you would like to stop by sometime tomorrow between the hours of about 8 and 4:30, we will be there. However, if you would like to receive a medication lock bag, I believe we'll be meeting up with Amy tomorrow, and correct me if I'm wrong, they'll be available on Monday probably.
Mhm.
Okay. So our regular hours are Monday through Friday, 8 to 4:30. If anyone would like to stop by, you're also welcome to give us a call to make sure that someone will be there when you are in the area. And I will also be sharing these emails back with Amy. And so hopefully we can figure out how to get these certificates to you guys. Thank you for sharing those in the chat.
Yep. Yep. That's no problem. I'm happy to do that.
Perfect.
Are there any other questions that I can answer? Thank
While we're waiting for any last questions to come in, I'll just let you guys know that there's a brief 6-question survey as you guys are leaving that just asks what you thought of the class and if there's anything that maybe you would like done differently in the future, or any suggestions for other classes. We really appreciate if you guys let us know what you thought, and that way we can hopefully do this again soon and get this out to more people. So thank you.
Thank you all so much for being here. If you know anyone struggling with opioid use disorder that is interested in treatment or just chatting, please feel free to share my name and contact information. And no pressure for anyone, just happy to just sit down and talk with someone and see what I can do to help get them on a different path. Thank you all so much for being here tonight. I appreciate it.
Oh, and great question. I'm sorry, I forgot to mention that. I will be sending out the recording tomorrow as well. And so you guys are welcome to share the recording, rewatch it. I will have that out to you guys by tomorrow afternoon. Thank you for asking that. And I don't see anything else, so I think we will wrap up here. But thank you so much, Amy, for another wonderful presentation. And thank you to everyone who joined live. We appreciate you being here.
Thank you.
Have a good night, everyone.